I saw a patient that came in for a dressing change. She had a small laceration that the doctor yesterday had cut into and fixed, and then he just had to repack it today. But as she was laying there on her side, she was obviously breathing heavy. And 70 years of age, sometimes we'll say that's okay, but as I was changing her packing, I asked her about smoking history, and she did have 20 years of smoking, at least a pack a day. So without even watching her breath, I thought that she had the history and the makings of COPD. And I'll leave it up to you as far as looking into what COPD means. It's chronic obstructive pulmonary disease. It's kind of like what asthmatics feel and go through, except when you have COPD, there's no usual rescue for the difficulty in breathing. You're always breathing like this because the lungs are not working right. Usually it's chronic damage that causes them to not absorb, not be delicate, and it leads you to a life of being stuck on inhalers and oxygen. This is oxygen. Usually carrying around this thing and or bringing the smaller oxygen containers or air pumps onto airplane or on a bus. You'll see people that have it strapped around their bodies. This is what we use in the emergency room or in the immediate care center whenever somebody comes in short of breath or in an asthma attack. COPD is when you can't utilize the lungs properly, and because of, again, chronic damage, and you need extra help. So you need extra concentrated oxygen going straight to the lungs to help with getting the blood levels of oxygen where they're supposed to be. Otherwise you feel fatigued, you get dizzy, you're confused, and the organs don't work right. So it should be a good enough inspiration to get yourself off of tobacco if you're stuck on it now. Otherwise, those of you who do have COPD, instead of using this and or getting intubated or having nebulizers all the time, sometimes what I would suggest would be not necessarily alternative, but complementary things that you do with life. Sometimes by working on breath work, increasing the lung capacity size, you might be able to get a little better with your breathing. Increasing lung capacity is usually in the form of exercise. Taking deep breaths in and out, utilizing the vital capacity. When you sit like this and or you're like bent over, you're actually compressing the full volume of the lungs. So sitting up properly actually helps. Learning to utilize different parts of the lung that you don't usually utilize will also help. That's in the form of yoga or breath exercise. There's something called an incentive spirometer that you can get in the hospital. It's kind of like I don't have one here, but it's a little plastic container with a tube. You breathe in and it sends a little blue ball up to a certain level, and then you breathe out. And you breathe in and it sends it up, and it gives you incentive to inhale. And doing that kind of practice on a daily basis 3 times a day is what we do when people are in the hospital. So they get used to how to utilize the diaphragm and the muscles between the ribs, the intercostals, and the rhomboids properly. That's exercise. And for those of you who don't do that and you're sitting like this all day, that'll make you sweat because you're not used to it. So those easy exercises are things you can do at home even without an incentive spirometer. You can do them. Just look at your average breath exercise that's done in yoga or Tai Chi, and you'll see what will help with developing those muscles. So that's one way, is to expand on what you naturally have already that you don't take advantage of. The other thing to do also is to utilize your nutrition. Get off of the crappy foods that most Americans eat, high preservatives, high fat, high animal protein. Get onto a mostly plant-based whole foods diet. And you can see my previous videos on the anti-inflammatory lifestyle to get an idea about that. But if you can't do that or can't afford it, or at least you think you can't afford it, then you try to invest in some supplements. I think fish oil is a great idea for increasing your omega-3 and equalizing omega-6 to omega-3 ratios. Without getting into details, and you can see my other videos on that, if you have nothing but omega-6, like in processed foods, hydrogenated oils in your label, and you have low omega-3, you're going to be pro-inflammatory, irritating all the time, joints, lungs, nose. If you balance that out and get more omega-3 to equal the omega-6, you'll have less inflammation, anti-inflammatory. That's what you want to do when you're irritated in the lungs. Increase your omega-3, whether it's by fish or krill. Krill, in my opinion, is too expensive. I know Joe Mercola pushes it a lot. I think the studies with the Lyon Heart study, the Nurses Health study have shown that any kind of omega-3 is good. Flax or plant-based omega-3 doesn't really get in. It's hard to absorb. So if you are vegetarian, fine. But if you can go into the fish-based products, I would say omega-3 in the form of fish oil or krill oil will be better, more superior. In addition, magnesium. The lung is made of bronchioles, tracheas, tubes that are lined with cartilage pieces, and then muscles that go around the tubes. If the muscles are irritated, the tube will be narrowed. If the muscles are relaxed, the tube will be open. You're supposed to be able to vacillate between opening, dilation, and closing, constriction, depending on your activity, depending on if you're exposed to smoke, depending on if you're a firefighter and you go into a burning building. You should protect yourself, but sometimes people who have COPD will always be narrowed down. So I think magnesium, which is again lacking in most American diets, would be nice to help relax the muscle and get the biggest size, diameter of the breathing tubes as possible. So magnesium, and you can see my videos on magnesium. Fish oil, magnesium, and finally probiotics. Any part of the upper respiratory tract, whether it's the nose, the back of the throat, the mouth, the lungs, the ears, any part of the respiratory tract is lined with bacteria. When you have bad bacteria, you'll have irritation and inflammation. When you have good bacteria, good mucus, then you'll have a good environment. If you have a good environment, you'll have a healthy lining. If you have a healthy lining, you'll exchange the oxygen rapidly. If you have an irritated lining, an unhealthy environment, then you'll have inflammation, and those cells, the paper-thin wall between the oxygen and the atmosphere and the blood vessel will be thick, and it'll be hard to transmit or get the oxygen to diffuse through. So this is all microbiology, but it's self-explanatory. If you think inflammation, you do everything that I said don't do. You eat bad foods, you smoke, and you sit like this all day. If you want to maximize on life without having to use so many nebulizers, so many oxygen therapies, carrying around this thing all day long, then you try to maximize on everything you can maximize on. You see your doctor, you do exercises, you increase lung volume, you avoid any carcinogens and irritation, and you maximize on nutrition. And again, there's options on an anti-inflammatory, mostly whole food, plant-based diet. And there's also other options as far as supplements that you can take. I'm a firm believer in supplements, but you have to kind of pick and choose your fights. The lady I was talking about earlier that came in for the packing change, when I watched her take some deep breaths or just sitting there using a lot of effort to breathe, I asked her what she takes as far as supplements while I was taking care of her packing, and she takes multivitamin, CoQ10, and a couple other things. And CoQ10 is very good for cholesterol, but it's very expensive. So I'd rather have her take the money that she's spending on the CoQ10 and invest it in something that she's ultimately going to need more than lowering cholesterol, and that would be fighting the lungs first, or getting best benefit with lungs. So forget the CoQ10, unless she's a millionaire. Forget the CoQ10, invest in fish oil, probiotics, magnesium, and then continue with the multivitamin, vitamin D. So hopefully that gives a little bit of guidance to her, but you can see how when you go to see an integrative medicine specialist, it's not necessarily taking everything that's out there on the web as far as what's healthy, antioxidants. You have to kind of pick and choose your fights and utilize your money to the best degree. Utilize what's available in your environment, in your grocery store, in your backyard, in your exercise routines that will maximize on the outcomes.